Now, Chris Fleming is the Chief Executive of the Southern DHB and joins me now on the line. Chris, how do you think this whole maternity hub model is working for women in Wanaka and Lumsden?
Well, look, the whole issue around maternity is very complex. The hub in Wanaka and in Lumsden, we have set up an interim hub. In fact, I'm grateful that Christie's birth did go well, but there is a hub in Wanaka. It is at the Wanaka Medical Centre, a matter of metres away from where Deb Harvey's office was located, and Deb had full access to that.
Do you think, sorry to interrupt, but I just noticed you said that you're pleased that birth went well. Do you think that was a suitable situation?
I think that the challenge around both firstly primary birthing and also secondary birthing is a huge challenge. We have implemented a model in Wanaka, but we have also recently signed a lease for a facility in Gordon Road in Wanaka to establish a more permanent hub, while we think about where we are heading in the future in terms of both I heard the call for a primary birthing unit, and the volume of women birthing in Wanaka is growing and continues to grow, and we have always remained committed that we're on a journey. The second issue is about the complexity about secondary birthing, and those who do need to access obstetric care presently in terms of the New Zealand health system can only access secondary maternity where there is full 24/7 services, including anaesthesia, obstetricians, paediatricians, etc. And so that's a big challenge that we have to face in terms of where are we going to head in that wider Queenstown, Wanaka, Central Otago area, which of course is a long way away.
So when you say you're on a journey, well, that's all good and well, but not so much for the women who are needing to give birth in the near future. So just to be clear, is that maternity hub, you talk about another location and that's going to be developed further down the track, is the maternity hub in Wanaka up and ready, and what level of complexity could they deal with there in terms of a birth?
We have an agreement with the Wanaka Medical Centre. There is access, we've got specific access to the procedure room, which has all the necessary safety equipment for primary births. For anything that is more complex, that requires secondary care, absolutely, forward planning and moving to a secondary facility is a requirement, and that's a requirement all around the country.
So do you think women should have
be provided?
Yeah, do you think women should have to run the gauntlet here with their pregnancies, take the risk? So, for example, you talk about forward planning. Well, Christy had forward planned. She planned to go to Dunedin. But the thing is, as you would appreciate, with pregnancies and births, things don't always go to plan. And that's the problem here, isn't it?
Absolutely, and that's why we rely on a combination of robust planning and relationship with the midwives, the emergency response services that are available, and the backup of the secondary facilities. It is a complex issue, and it's not as something as simple as being able to open a secondary facility in that geographical area. But
why
when
not?
we look at the demographic, because you need 24/7 surgical services, medical surgical services. You would need a minimum of 4 obstetricians and 4 anaesthetists and paediatricians to make a viable, safe roster. If we try to do something like that with lesser resources, it would not be sustainable and it will not be safe.
So should those women in that area just miss out then?
No, it is a challenge right across the country, and in Southern it is even more complex with the large geographical areas. It's not possible to provide multiple 24/7 services across the vast region that we are.
So is it? Yeah, I understand what you're saying there. So then does it follow that it's unrealistic for women to feel safe and secure in their pregnancy and in their birth plan if they live in a small town like Wanaka? It's just unrealistic.
No, I think in terms of being open about the risks that are associated with the pregnancy, forward planning, and remember one of the things that the DHB has done in terms of prior to the establishment of the hub, and then moving to the more permanent location later in the year, there was nothing other than whatever the midwife carried in her her car. Whereas now there is a place for safe, urgent primary birth. It is a step forward, and we are going to have to continue to explore what do we do in that wider basin.
Right, you've said more than once that people need to plan well ahead. I'm just wondering what you mean by that. So how far in advance of their birth should they move to Dunedin or to a place where there is a hospital? How far ahead should they do that? In your view,
that has to be that would be a discussion individual by individual with the midwife. But
but there was that discussion. I suppose that's the point. There was a discussion between Christy James and her midwife, and we're just using this as an example. So she was sticking to the plan and had planned to travel ahead to Dunedin, but obviously things don't always go to plan. So, I mean, realistically, do you expect these women to be spending 2, 3, 4 weeks in Dunedin waiting to have their babies just to be sure?
No, there are always going to be the challenges, and those challenges occur both in the rural areas and also even in the metropolitan areas where there are urgent births. It is one of the challenges, however, of living in a rural setting that those options and those issues do need to be discussed, and there will always be the challenging, the unexpected urgent situations as Christy has experienced, and that's why we've put the infrastructure, the support, and we've recently, we've enhanced the emergency transport. The helicopters have been replaced by twin-engine helicopters to enable more inclement flying as well. So we're continually trying to improve the services, but it is challenging, particularly southern. The region that is as large as Belgium. So
doesn't it simply come down to, do women in rural areas deserve the same level of care and medical access in their pregnancies and births as women living in urban areas?
Every woman deserves access to appropriate services. The geographical challenges, however, make
equal,
it physically
is what I'm saying. Equal.
But it's physically impossible to provide those services everywhere across a vast landscape.
So they just need to... So do they need to accept that inequity if they choose to live in a rural area? Is that what you're saying?
No, it is a challenge around how we provide robust services and ensure that appropriate transport and support is available.
We're almost out of time, but just before you go, are you going to make any immediate changes as a result of what happened in Lumsden or what happened here in Wanaka?
Well, we're about to do a post-implementation review of the model, but I just do need to reinforce the birth in an office. There was a procedure room immediately available with all the necessary emergency equipment for a primary birth that was available just around the corner in the same facility. So
what are you saying?
That we are confident that the primary birthing, the maternal and child hubs have appropriate safety equipment.
So do you think that this woman and the midwife chose not to go into that centre? Were they making a statement by having the child in an office?
Well, the office was in exactly the same building as the procedure room with all the emergency equipment within the same building.
Chris Fleming, Chief Executive of the Southern DHB, thanks for joining us this evening.